Welcome. This video will demonstrate the physical examination of the shoulder. This is a standardized exam flow for the clinicians here at Restore PDX. So to start out, we're going to assess for range of motion. So Rob, can you bring that shoulder up like this? Great. How about from the side up this way? Very good. And then out this way. Great. Okay, so I didn't see any limitations in the range of motion, so I didn't call out anything. But what we did there was shoulder flexion, shoulder abduction, and shoulder extension. Commonly with rotator cuff injuries, shoulder abduction is going to be the one that's going to have a deficit and one that we're most interested in. Next, for the shoulder, we don't really have to assess the reflexes or the neurologic function, so we're going to get straight to palpation of specific structures to try to help determine our diagnosis. So I'm going to start at the anterior shoulder. Rob, just going to have you go like that. I'm just going to palpate a few areas. Let me know if this reproduces your familiar pain. Anything there?
No.
Okay, so this is the biceps tendon as it comes in, and it's non-tender palpation. Here, up at the top of the shoulder is going to be the AC joint, non-tender. On the side here, we can palpate the supraspinatus tendon, tender there?
Little tenderness there.
All right. And is that familiar pain to you?
No.
Okay. Now we're moving further posterior to the infraspinatus tendon. And then I'm going to be right here, I'm palpating the glenohumeral joint.
Little tenderness.
A little tender, so tender to palpation at the supraspinatus insertion, tender to palpation at the glenohumeral joint. And there are check boxes in the IMS basic exam flow that'll be really simple and really quick to document that. Now with the shoulder, we'll take a look at some of what we would call special tests. And these special orthopedic tests help us narrow our diagnosis. These may or may not be included depending on how specific or how familiar we are with the patient's presentation. We might already have the diagnosis and not need to do many of these tests, but for a new patient, you'll often find the clinician doing this. So the first test that I'm going to check for is shoulder crossover. So I'm going to have you bring your shoulder and go like this. Any pain with that?
No pain.
Okay, great. Now go ahead and bring your shoulder up to here, and a little higher, right like that, great. And turn your thumb down, okay? So this is an easy test to remember. It's empty can, as if he's pouring out a can of soda. Any symptoms there?
No symptoms.
Great. All right, and relax there. The next test, I'm going to have you bring your arm and shoulder up like this, and resist me pushing here. Pain with that?
No.
No. So this test is called Hawkins Kennedy or Hawkins, and that is negative. Great. So those are the signs of impingement that will be on the IMS chart. The next will be signs for rotator cuff. So I'm going to have you put your arm here, and what I'm going to try to do is pull your hand away from your belly.
Okay.
Don't let me. Great. So that is called belly press test, negative for him. Go ahead and put your hand and push off. That is called Gerber's lift off. That is negative. Great. Next, we're going to test for biceps tendon pathology. Go ahead and flex your elbow there. Very good. And don't let me push in. Great. Any pain there?
No pain.
Don't let me push out. Any pain there?
No pain.
Okay. So that's called Jurgensen's. If it was positive, he would have pain up here where my finger was. The next test is called Speed's test. So go ahead and bring your arm up here. I'm going to have your hand like that. I'm going to switch here. Okay. So Rob, I'm going to push down with this hand. What I like you to do is resist me, but let me win.
Okay.
Okay? Yeah. Any symptoms with that?
No, a little bit.
Okay. So sometimes it's not a clear yes or no on the examination. So what we can call that is equivocal. It's not negative, it's not positive. I'm not sure if that's really going to be causing his problems, and we may not need to treat it, but there's something there. So we're going to call that equivocal Speed's test. The one other thing to note is with the biceps tendon, if there's a full rupture of the distal biceps tendon or even the proximal biceps tendon, what will happen is the muscle will bunch up and it will look like the patient looks like Popeye. You know how he had the big biceps? And that's called the Popeye sign. So as we're looking here, obviously Rob's a fit guy, but he doesn't have the Popeye sign. So that would be negative. The next exams are for glenohumeral labrum pathology, and there's a specific subcategory of the shoulder exam for these two tests. So the first one that we're going to do is called Crank's test. So Rob, can I have you bring your shoulder like this with your elbow flexed? Great. What I'm going to do is I'm going to push in and rotate the shoulder. Any pain with that?
No pain.
I can feel a little popping here. Yeah. But so this is cranks. It's pretty easy to remember. We're just cranking the shoulder back and forth. Okay. Next test is called O'Brien's test. So for this one, bring your arm up actually in this plane, kind of like that. Great. Up a little higher. Now what I'm going to do is we're going to go full rotation there. Any pain with that? And then we're going to go full rotation here. Any pain with that? Great. So cranks is negative. Now, the next tests are for stability of the shoulder, or testing for instability. This can be done both seated, like Rob is now, or supine with him laying down. I'll demonstrate both of them, but so with you seated, can you go ahead and bring your arm up like this? Great. What I'm going to do is I'm going to apply some pressure here. So what I'm testing for is whether or not he resists me and tries to push forward, because that would be a sign that his glenohumeral joint might be unstable or likely to dislocate. So that is the apprehension test. Now go ahead and lie down. And again, we're examining the left shoulder. So this is another way to do the apprehension test. I'm just seated here next to him, and I prefer this one because if he does have some instability, I can have my hand here to help. But I'm just going to push back. Don't resist me, just let me go back. Great. No apprehension there. Now the Job's relocation test will be that if he has positive apprehension, if I put pressure down, does it take the apprehension away? And if it does, that's a positive test. For him, there's no positive apprehension, so there's no reason to do Job's to begin with. That concludes the shoulder exam.